Pharmacist Interventions Part 4. I like to dose ibuprofen and Tylenol for my pediatric patients and infants. So I have caregivers that come to the consultation window, ask me how to dose liquid ibuprofen and Tylenol for their, say, 8-month-old. So I do it by weight. So ibuprofen is 5 to 10 milligrams per kilogram, and Tylenol is 10 to 15 milligrams per kilogram. It's dosed about every 6 hours. Ibuprofen is approved for patients 6 months and older, and in Australia it's approved for infants 3 months and older. You need to be very careful with the dosing because of the many black box warnings it carries, being ulceration of the stomach, increased risk for clots, as well as renal or kidney problems. Speaking of kidney problems, another thing I like to do is dose medications for my kidney failure patients and recommend therapies over the counter. So I have some patients who are CKD4/5, chronic kidney disease stage 4 and 5, patients who are on dialysis and they're not clearing drugs as well. Most drugs are renally cleared. Most drugs are cleared by the kidneys. So when your kidneys aren't working, they're staying in the body. And when they stay in the body, you get a lot of toxicity with that. So you need to be very careful with these patients. Some drugs are not cleared by dialysis as well. For example, colchicine. Colchicine is a commonly used medication for gout, for acute gout attacks. And at high doses, it acts as a chemotherapeutic agent, kind of like a vinca alkaloid. So it's very dangerous. You need to watch those patients. I've had a patient prescribed ciprofloxacin, CKD4, and I've dosed that medication for them or recommended an adjustment based off of what I believe is actually appropriate for the patient versus what was sent in by the provider. I've had a patient prescribed baclofen when she was on dialysis, and she shouldn't have been getting that medication. I'm going to go into that in a later video of what happened. I've had patients come in with high blood pressure, and I've taken their blood pressure. I have a cuff in the back of the pharmacy. Say it registers too high in the machine and they want me to take it, I will personally take their blood pressure. It doesn't matter how busy it is. If it's dangerously high, if it's over 180, I will take it. I had a patient with a blood pressure of 260 over 140 that I sent to the ER, and they came back the next day with some blood pressure medications, and then I counseled them on those. I've had patients try to pay for their psychiatric medications that were $600, or that was $600. It was, I think it was Lamictal and an antipsychotic. It's for my bipolar patient. And I knew it was a lot cheaper on GoodRx, and I sent them for Kroger. I found the coupons, and I let them take a picture of my phone, and it was about $30 at Kroger for their medication. So I didn't want them paying like hundreds of dollars at my pharmacy when I knew they could get it cheaper elsewhere. So I let them know about that.